Hi everyone, welcome back to Beyond Your Knowledge. So today we're going to be studying important antipsychotic side effects. But before I continue, I would like to share with you Proverbs 27:5-6 and read as: Better is open rebuke than hidden love. Faithful are the wounds of a friend, profuse are the kisses of an enemy. Amen. That was Proverbs 27:5-6. Yeah, so now in the important antipsychotic side effects. So what are those? They are classified in, we classify in extra pyramidal side effects, also tardive dyskinesia, tardive dyskinesia, and also neurolytic malignant syndrome. Neurolytic malignant syndrome. Now, all of those, are side effects of the antipsychotics. Well, now we're going to see each of those. So we're going to see each of those here. I'm just going to put the word syndrome here down better. More room. Then do it like this. So we're going to start with the extra pyramidal side effects. So basically, there is an acute dystonic reaction. So what do we have? An acute dystonic reaction. And in this acute dystonic reaction, it is a sudden onset, occurs sudden onset. And the problem here in acute dystonic reaction is that the patient has a sustained muscle contractions. So sustained muscle contraction. Then the other one in the extrapyramidal is akathisia or akathisia. Akathisia, so it is basically subjective restlessness with inability to sit still. So basically they cannot be still. They can't be still. So they are restlessness. Then the other one is drug-induced Parkinsonism. Drug-induced Parkinsonism. So the drug-induced Parkinsonism. So it's going to present with tremor. They present rigidity. Rigidity. Let's just fix this better here. I have more room. And then just cool. So now, so this one, they present with the rigidity, tremor. Also they present with bradykinesia. And they present with mask phases. Okay, so probably it would be a good idea if we remember what is a bradykinesia. So brady, remember that is low, and kinesia yeah. So low movements. Okay, so before I continue with Tardive dyskinesia, let me just say bradykinesia, so which is here, this one, in one of the drug-induced Parkinsonism. So drug-induced Parkinsonism induced cause tremor, bradykinesia, and mass phases. So what does mass phases mean? Mass phases mean, so when the patient has, for example, hypomania, so that's mean that there is a medical sign which is a reduce the degree of the facial expression. So basically they don't express with their face what they are feeling. So because it reduced the reduced degree of the facial expression in mass phases. So and bradykinesia, so it is a slow movements. Okay, so basically is that now we can move on to tardive dyskinesia. So tardive dyskinesia is another important antipsychotic side effects. So this one, the patient is going to have an involuntary movement. Okay, so also in this one, involuntary movements when, so after chronic use. So that's mean that after chronic use. Okay, so example, what kind of example the patient is going to do that we call lip smacking. So let's just say here's an example here. So lip smacking. Okay, the other one that they can have is a choroathetoid movements. Okay, chorioathetoid movements. Okay, so basically just like dancing or something like this, with moving all the arms and all the body, all those things. Okay, and lip smacking, which is okay. Now all those are not fun, but there is another one more, which is the neuroleptic malignant syndrome. The neuroleptic malignant syndrome, so remember that syndrome, that means it's going to involve more than one organ. So in this one, the patient is going to present with fever. The patient is going to present with a rigidity. The patient is going to have changes in the mental status. So that means the mental status changes. The patient also is going to have autonomic instability. Instability. Okay, stability. There we go. Okay, so basically those are the important antipsychotic side effects. But when which kind of patient are at risk to develop this? So well, the patient that is taking antipsychotics for sure. But one example of patients that are taking antipsychotics are, for example, the schizophrenic patient. Okay, that they suffer which kind of disease? Schizophrenia. Okay. Now this has happened when we treat for many years. Okay, that can cause treat for many years. Okay, and yeah, so they can present, for example, with tardive dyskinesia or all those things. So because the tardive dyskinesia, do you remember that they have a problem with the involuntary movements? Yes. So if they have problem with involuntary movements, so in tardive dyskinesia, so what do you think that is going to be? Is because they have a long term treatment with what? With dopamine antagonist. Okay, with dopamine antagonist. Okay, now the possible mechanism of tardive dyskinesia is because the possibility is that there is a supersensitivity of the postsynaptic, so there is going to be hyper sensitivity of the postsynaptic what? If it's dopamine, it's going to be, yeah, there we go, D2 receptors. Okay, now then following prolonged D2 blockade, okay, and then the patient is going to have an imbalance between the D1 and the T receptors. So then it's going to have an imbalance between D1 and D2 receptors. Okay, so for this reason they present with this is the basically the mechanism of the theory or the idea or the mechanism of action behind all this. Okay, also so basically what we can do with those patients. So first, before we know what we can do, so usually this happen mostly with the first generation of antipsychotics. Okay, so what we're going to do, so we're going to switch to second generation, okay, or we can switch to what? That is a drug. There we go, to Clozapine. Okay, switch to second generation or Clozapine. Okay, there we go. Yeah, so so preferable Clozapine. So you want to close the problem with the Clozapine, but so Clozapine also causes bone marrow suppression. Okay, so so I think that we are done, and thank you so much for watching, and we can do all things through Christ in us, and God bless you all.